Yeah.
Hello, this is Integral Dose Podcast. My name is Sarah.
Hello, my name is Sarah.
Another
Another
day,
day,
another
another dose.
dose. So, this is the podcast that covers all things related to integral to radiation therapy.
Working in the medical field is not only about taking care of patients, and in radiation therapy, it's not only about delivering the treatment or providing treatment related care to our patients. Providing this care actually requires very careful and meticulous research to ensure that our techniques and advices to patients are backed by science. And this is where our main topic for today comes in, which is about how to get into research. So getting into research can indeed sound very daunting.
Yeah, it does sound daunting. So, have you done any research before, Sarah?
Actually, the last time I did was for my degree, for my thesis, but
Oh,
I researched lah about traveling. So, what
travel.
about you, Sarah?
No, I've not been into research because I think, like you say, like it's daunting. So, and I never got the time to. I never really had the luxury of time. But no worries. Today we are joined by our colleague Shafiqah, who will be telling us about her research things, what she has.
How she got into it,
Yeah, correct.
things like that.
Hey,
Okay, so
Shaf.
Shafika.
Hello, I'm Shafiqah. I've been a radiation therapist in NCC for about 4.5 years.
Hmm.
I've been on the clinical floor at the photon therapy site, brachytherapy, and also proton therapy.
What sparked your interest in research?
What sparked my interest? Actually, at first, when I started as a radiation therapist, I didn't want to be inside research.
Oh.
But then the more I worked,
Same.
the more I worked and the more I realized that we all had a lot of like unanswered questions, or like even if you have answers, they're not really like fit in the Singaporean context or the Asian context. Yeah. So they all, the Western side especially, they have different protocols, but then on the Asian side we don't really have a lot of like articles.
Any specific area of research that you are most interested in? Like, can you share about something that you're probably doing right now?
Right now, I am working with my senior who's an APRT in gynae.
Mm-hmm.
So right now, the study that I'm doing is for gynae patients, more specifically about how we can tweak their diet to help them with their treatment interruptions during treatment. So like often the gynae patients, they have resetups due to fecal loading or gaseous bowels. So we are trying to see if we give them a specific diet intervention. We are trying to see if it helps them with their treatment interruptions, which means lesser resetups for them lah.
So for those general listeners who doesn't know what is APRT, so APRT is an advanced practice radiation therapist. So they are not really a group, but it's an individual.
An expert in the field?
Yeah, they are more expert in the field. So
Mm.
for example, Shaf did say it's a APRT in gynae. Most likely all the gynae cases are being handled by this APRT. If there's any problems or whatsoever, they will approach these APRTs lah. Hey, that's interesting. But before that, right, you have another research that you did presented before, right?
Yes.
What was it?
Previously, I did a research about BMI and also the setup reproducibility for breast cancer patients. So for that one, we wanted to see if BMI affects the reproducibility of the resetups for the breast cancer patients lah. So we found that for our context, the underweight and also overweight patients had more resetups than the normal weight patients. Initially, we had the mentality that higher BMI patients will cause more resetups. But actually, the underweight patients also give rise to
Issues.
more resetups. So that was something that we found out unexpectedly.
So going back to the gynae research, you talk about resetup and reproducibility. Can you just elaborate more about what kind of resetup? What do you mean by resetup and the reproducibility lah, for our general listeners to understand? I think the concept.
For radiation therapy, we focus a lot on reproducibility. So position of the patient matters every single day for us. How they were being set up at CT scan, at the CT simulation, we want them to be in the same position even at during treatment. Yeah, so we talk about reproducibility. We want to be able to reproduce the same position every single time they come for treatment. If their position is out of tolerance, we cannot accept and proceed with treatment. We will have to reset up the patient, make sure everything is good, the position is good within our tolerance, then we can proceed with our treatment.
For example, this gynae patient requires her to fill up her bladder,
Mm.
but at the same time, her rectum needs to be empty, right? So if there is fecally loaded in the rectum area, means you also have to reset up, correct?
Yes.
So you have to actually bring patient down
Yes.
and then ask her to
try to pass motion.
Okay.
Yeah.
All right.
Wow, that sounds quite like quite a complicated study, right? Because in the local context, Singapore has really good food. I mean, most people here love food lah, so sometimes it's quite hard to control diet even when they're on treatment, right? So what are like the challenges, or how do you feel patients usually respond when you come to them with this advice? Like, let's say they are supposed to follow this set of dietary preferences. How do people usually take it?
Initially, we told the patients to follow a specific set of rules, which is usually low fiber diet, less spicy food, less dairy, all this. And some of the patients even resort to just eating fish soup, and they were quite depressed. Yeah, so we also understand that being on treatment, we don't want you to be depressed. We still want you to be able to eat normally, just tweaking a little bit of what they eat daily lah. So my study, we actually curated a food diary, and we worked together with a dietitian from another hospital, specifies in gynecology also. Together, we curated this food diary in hopes that the patients can see that actually they can eat a lot of things. And this food diary also consists of recipes across different cultures,
Wow.
different diets also. Yeah, to show to the patients that they are actually free to eat whatever they want. They just have to tweak a little bit of the recipes only.
Wow, so actually you guys managed to incorporate the fact that different cultures have different food preferences and then tailored it to them. I think that's really amazing. I don't think I've seen dietary like pamphlets given to patients with those kind of preferences. I think that's a really good job.
I think I've seen her food diary before. She
Oh,
actually
okay.
photocopied the food diary. And then it's actually very nice and colourful.
Yeah, I also want to see it later.
So I guess those who receive her food diary, I think will be more motivated to try the recipes. There's recipe inside, right?
Yes, there are recipes.
Did you actually try it yourself?
I did not try it myself.
Maybe you should. You should try.
Maybe I should open up a cooking class.
But so far, I believe the compliance rate should be quite high lah, since it's not like, very restricted. Because when people hear, I need to follow a diet, wow, stressful on top of having to come for treatment, right? Yeah.
The compliance quite good
Quite
actually.
high.
We also give them a food diary
Mm-mm.
apart from the cookbook. The food diary encourages them to jot down what they've been eating. A lot of them diligently jot down what they've been eating.
That's like
Wow.
journaling.
Yeah, that's like journaling.
Yes.
Yeah.
Then we also provided them with stickers that they can paste. Whenever they feel tired, they can just paste what they've been eating. Yeah, so
Wow.
that one encourages compliance as well.
Interesting.
Where can we find this
Can you give me one?
cookbook? Can we find it online?
This cookbook is not available yet unless you
Okay.
are a patient in my study.
She must be a patient in the study.
Okay. But eventually, probably we rolled out lah.
Hopefully,
Like on the NCC website. So stay tuned, guys.
Yeah. Interesting. What about those vegetarian? You have cater for vegetarians?
Yeah, we do have vegetarian recipes. Also, inside the recipes, we do tell the patients you can substitute the protein to tofu or fish or up to them. We also included appetizers and also desserts.
Wow, that's amazing. That's so extensive. Yeah.
Yeah, for them to enjoy.
So interesting. How has it been going on so far? How many do you have to recruit? What is the criteria for your patient? I don't know. What's the...
Talking about sample size?
I wouldn't go into too deep, but like for example, what is your main goal, your target?
So my target for my current ongoing study is to see whether or not this cookbook helps the patients, again with their reproducibility and the resetups. In my study, I have the control group and also intervention group. Yes, so the control group, I only give them verbal advice which we have been doing all these years.
Mm.
The intervention group will receive the cookbook and also the food diary.
I see.
So at the end of the day, I want to see if the resetups actually reduce for the intervention group, and if it does indeed reduce, then maybe we can have a bigger study to recruit more patients, and maybe we can also even go and give this cookbook to the prostate patients and see if it helps them also.
Very
Yes.
important for prostate patients. So the main goal of the study is basically to maintain weight, or like for patients who are underweight, that have very low BMI, is their aim to maintain that or gain it to a certain threshold, and then for those with higher BMI to lose or to reduce their BMI. Is there like a threshold to reach?
Not really.
Mm.
So for radiation therapy, however the patients were at CT, we want them to maintain that. So I don't want the patients to gain weight or lose weight. I just want them to maintain. For my study, more importantly, I just want them to have lesser gassy bowels, gaseous bowels, and also lesser fecal loadings.
Okay.
Yes.
Okay.
Generally, for radiation therapy, a lot of patients lose weight, right?
Yeah.
So I also aim for them to lose lesser weight lah.
Okay.
Yeah.
So when we talk about prostate just now, I think the reason why we want to reach out to prostate patient as well, because the dietary requirements is also important for their treatment. Gynae, we want a empty rectum, and some cases needs a bladder fill up, right? But for prostate, all of them needs to have a bladder filling and also very empty rectum as much as possible. No gas at all also, which makes it even more important to reach out for prostate patients. Yeah.
They are both pelvis
correct.
radiation therapy. So the protocol is similar.
Yeah.
Yeah.
And we see resetups in prostate patients because of their gassy bowels and also fecally loaded rectum. Yeah.
So just to backtrack, right? Maybe we can explain why we usually expect patients to lose weight during RT. For a lot of patients, when they go through RT and their side effects come in, depending on where they are being treated, they may lose appetite to eat, or they may get like loose stools and some nausea. And then naturally you don't really feel like eating lah. The appetite goes down, and therefore a lot of these patients, they lose weight over time.
Actually, I did a survey before I started my study, and I asked the patients, did they change their diet upon diagnosis? A lot of them said yes. So they wanted to try eating healthier in hopes that it wouldn't worsen their disease. So that could also affect their weight.
Oh, yeah.
For sure.
We can reach out to our head and neck patients as well.
We can.
For future research lah, huh? Right,
Can.
Shafiqah?
Anybody
Okay.
interested?
Yeah, our head and neck especially.
I think Michelle is like doing something like that.
How do you feel embarking on research or this study journey? Do you feel like a sense of fulfillment, or
Like, was there a specific interaction with a patient
that
or
sparked you to
a
like?
situation? They'll be like, actually this research is so important, like I want to do this based on like my interaction.
Actually, for my first study, it's more of in a team. In my previous team, we had a lot of questions, but then nobody was really like acting upon it. Like I mentioned, even if we read articles, they weren't really like applicable to us. Yeah. So I asked my senior if there's anything that I could do, like in a small scale lah, because it was my first study in NCC. So she said, yeah, you can start on this study, which is the BMI and also the reproducibility in breast cancer patients. And then so I started on that first. Yes. So that was my first study. The second one is more of when my senior, the APRT, the gynae APRT, she kept telling me stories about patients not eating, only eating fish soup, or one of the patients was crying, telling her, I cannot eat ice cream during treatment. And then my senior said, who said you cannot eat ice cream? Tell me.
Maybe online lah.
Yeah, so a lot of them have a lot of misconceptions, or they are scared to eat. They read a lot online, so they are very wary about what they are consuming. Yeah, so actually it was a joke. I told my APRT, why not you cook lah? You cook for your patients. And then she turned to me, actually,
Why don't we do cookbook?
why don't we do it? Why don't we do a cookbook? Then
that's
I say, ha
amazing,
ha
yeah.
ha. Then she said, no, you do it. So I was like, oh, okay. Sure.
So she arrow at you
She wanted to give me something lah.
Oh, okay lah.
So I was like, oh, okay. Yeah, sure, why not? So that's how we started the cookbook journey.
You have interest and passion about it lah. Like for some, I think you must really have interest in doing studies and research, because the data that you are supposed to collect from your studies are not as simple as okay, oh, this patient one sample size, the other patient two sample size. You have to interpret the data, and then you have to present also the data and how it correlates with the hypothesis that you have come up with lah, correct? So it's not as simple as like ABCs. There's a lot more on research. So
Actually,
oh,
I feel like I swore off research since
swore off.
my thesis days, like no more research. But you know what? I think after speaking to Shaf,
Oh,
I
you
feel
want to do
more
research?
inclined because I think research quite fun. Make cool book.
Actually, research is okay.
Yeah, I mean research is a good thing because from research then people get to know how other centers do things.
Yes.
Improvements or
Yeah. So without research, right, you basically you're just blind.
you can't do anything actually.
Yeah, you just don't know what the other centers do.
Evidence-based practice, guys. Everything here is based on that.
Yes, you get results applicable to your patients.
Yes, local context, very important.
Correct. I know lah, actually research not so daunting lah about the data and everything. You just have to have a good senior, a good mentor to guide you. And then because I'm not good at stats also. I'm not good at data analysis. So what I do is my study members, I make sure somebody is good
At the data one, so you just do the research, then the person will run the numbers, right?
So I do the
see.
brain work, I do the writing, but they do the stats analysis. Yeah.
Okay.
So you can always work
as a
team.
team.
Yes, correct.
Yeah. So actually research requires a lot of reading, a lot of writing, revisions, a lot of collaborating with others, teamwork. So actually how do you manage your time? Like, we are working 5 to 6 days a week. After work, you're home, you're tired. Where do you find like the time or the push factor to continue reading papers, finish up your drafts?
So a lot of the time, actually half of the time, I choose to stay behind after work about 1 or 2 hours to work on my study because this is something extra that I decided to take on. So I'm okay to stay that 1 to 2 hours after work. During clinical hours, in between time, I will work on my study, but then I prioritize the clinical floor. I prioritize treating the patients. And also after work hours, there's nobody around to distract you lah. So I can work better on my study.
Sounds like somebody I know.
Yeah, so when I have time in between on the clinical floor, I will work on my study. Otherwise, I'll just work on it after clinical hours. Yeah. So actually, having team members is also important because you can delegate the work.
Share the load,
also.
share the load.
Yes, correct. You're not alone. You're never alone.
Of course. But talking about staying back, like, this needs dedication lah, right? Like, I would have stayed back, I think. Given the
option
opportunity
lah.
I think it's a bit too daunting still for me.
Too daunting still.
I feel like if you have your own study, it's like your own baby, Like you want to
You want it to grow.
see the results. You want to
Yeah.
get the results. So you're okay with staying that 1 to 2 hours. And it's not every day. It's only like 1 or 2 days. Yeah.
I mean, the center is so big, I'm sure you can find somewhere conducive.
Yes,
right?
correct. Yeah.
Kudos to you, Shaf.
Kudos indeed.
Kudos.
So maybe let's get into how does one, get into research? Like, let's say I'm interested in this topic. What do I do first? Like, let's say I'm clueless. I don't know who to look for. I don't know how to even start.
To get into research, firstly, you must know that the question, it doesn't have to be extravagant or it doesn't have to be groundbreaking. It can be a simple question that you want answers to. Yeah, you can start something small or you can build up from existing studies. Yeah, so you can ask around whether a study has been done, and if it has been done, you can just build up from there. Yeah. After that, you can just approach a senior that can mentor you and you gather the help that you need in terms of statistical analysis or in terms of writing. And then for the Institutional Review Board, or IRB in short, we have our administrator that can guide you in how to fill up the form. But bear in mind that you have to do your own research first, your own background reading, so that it's easier for you to fill up the IRB. And also for prospective studies, more often than not, you have to have your study protocol. So that study protocol can get the template also from the administrator. A lot of the content in the study protocol and also the IRB, they are repetitive. Yeah. So basically what you need is your background knowledge, all the studies, all the articles that you've been reading. So you put that in as your introduction, your background. Slowly you fill up what your hypothesis is, what your statistical analysis is, what your sample size is. Yeah, all this with the guidance of your mentor.
How long does that typically take, filling up the IRB?
The IRB is not very straightforward. You have to be specific in what you are researching, in the number of patients that you are recruiting in your study, the methodology. It can take about a few months because even when you submit, it can bounce back to you when they have questions, and then you have to rectify and you have to edit your submission again. Yeah, so it takes quite a while for the application, and only when you get the approval from the IRB, then you can start your study.
Sounds difficult.
I think we just want to be clear that, because we
IRB.
are part of SingHealth, we have our own IRB. So maybe things run a little bit different compared to other centers. So please check with your management or institution on how to run that if you are interested.
So this IRB is actually more for ethics purposes, to make sure that we handle the data correctly and there's no mishandling and there's no leaking of patients' data. Yeah, so they just want to make sure that we only collect what we need and that we store the data within the hospital's network.
Sounds difficult to fill up the IRB form. It takes like months, is it?
Yeah, maybe about 3 months
before you can start your study.
Yeah.
And I think many people just hearing that, they would probably just stop at even filling out the form.
No, but do it for your patients.
Please do it for your patients.
So when you say about preparing the materials before you even fill up the IRB forms, meaning is to say you already know what is your end goal in mind lah. You just have to present it and propose to the IRB, correct?
Yes.
So your cookbooks, recipe, all that means you have already prepared all the recipes beforehand.
Yes. So I already know what I want to do as my study. I prepare everything beforehand, the cookbook, the materials, because all this they want to see in the IRB. They want to see what am I giving out to the patients. Yeah, so they would just want to make sure they protect the patients well, basically. Yeah, we need to tell them upfront what we are collecting, what we are presenting, so that the patients are well protected and that we don't mishandle or give them wrong information or anything. Yeah.
But is there a possibility that after all these prep, the IRB gets like bounced back again and again and again?
If it gets bounced back, then you just have to keep editing it again and again. So like they will bounce back and then they will ask you questions, as in specify which part is it that is not acceptable to them.
Understand.
Or like they want more clarification. And also when it bounces back, our administrator will also help you try to answer them better. Yeah, as in like try to rephrase our sentences
In a way that
or
that
be
is more
more
appropriate.
specific. Yes. Yeah. So our administrator is very, very, very experienced in dealing with IRB, in dealing with all these documentation processes. So she will be able to help with all this IRB stuff.
This IRB is related if you involve patient, correct? But if you don't involve patient, for example, you just want to collect data from whatever you see, like from their scans, just numerical data or data that you see, and then you just make a hypothesis from there. Does it have to involve IRB?
Still have to involve IRB because you are still collecting patients' scans or data. Yeah, so in the IRB, they will also state whether or not you need consent from the patient. Yeah, so if it's like retrospective kind of study, most likely don't have to, and then they will say no further action to be taken, and then you can proceed with your study. But then if it's a prospective study, they will tell you need informed consent from the patient, and then you have to upload the informed consent document as well. Yeah.
There's a lot of work to do.
A lot of work but fulfilling, right?
Yes.
So don't be taken aback.
Yeah, I tell you, it takes dedication.
Takes dedication, yes.
Dedication and passion.
Definitely, definitely. I would say.
So when you're doing this research, what is your expectation so
Yeah.
far?
Along the years, when I do the research, I've come to realize that although I have a hypothesis, I cannot expect to prove that hypothesis because actually all my studies, my hypothesis was not proven.
But that's okay. That's okay.
Yeah, that's okay. That's okay
yeah.
because whatever results I get, those are still valuable results.
yes.
They are
It's
still
still valid.
worth presenting.
Yes,
Yes, they are
correct.
still worth presenting. There are still trends or observations that you can take note of and you can present. And then you can build on from there. So these are unexpected findings that you get from your study. And that's why you have a study. Because although you have a hypothesis, doesn't mean that is the answer.
Right,
Yeah.
and maybe in the future, people who are interested in this topic again, they may find something else and build up on it, right?
Yes.
Yeah.
Feel free to build on.
Yeah. I mean, research is a stepping stone for other people to do more lah. So
Mm.
without research, actually, we cannot go forward.
Yes.
I feel lah.
Somebody has to answer those questions.
Correct.
I think that's why our center is always, or our department is always
Pro research.
super pro research,
Yes.
pushing for people to do more research, because no matter what results you get, they are still results.
Yes.
Yeah. So after writing IRB, right? So what comes next? Like, is there a long waiting time to collect data? How long does it usually span across? Or example from your study?
After getting the IRB approval, actually there's one more step, the e-data request from the SingHealth site. I don't know about other institutions, but the SingHealth site, we have to have this e-data request. So only after your IRB is approved, then you can get this e-data request. You request for getting data.
I see. So
Yes.
it's an application form lah, something
It's
like
another
that.
application form. So inside the e-data request, you have to attach your IRB approval.
Ah, okay.
Yeah. And then after the e-data request, then you can start your study proper.
How do they release data? Like they just approve of
It's
you getting
more-
the data?
It's more of I can start collecting the data.
Ah.
Yeah. So it just shows that
Mm.
I want the patient's data. So I'm requesting for it at the SingHealth site.
And then you
Yes.
can start rolling out, let's say, like
Yes.
shortlisting patients
Yes.
and then taking informed consent.
Yes, correct.
Ah, okay,
Yeah.
okay.
And then all this, the e-data request, it takes quite some time also. Yeah, so pro tip, if you want things to get by faster, just email the person. So like they will put there the names of the person,
In
like
charge
where
lah.
the journey of the
The file.
request. Yeah, where it is.
Mm.
You just email them. Just say, hi, is this
Has this been looked through?
Yeah, has this been looked through?
Mm.
Can you approve it?
I mean, to be fair, I think they receive so many requests in a
Yes.
day.
Yeah, sometimes
But-
they might overlook it.
Yeah,
so
that's true.
it helps you also. It helps them also. Just to
Anyway,
send
no
an
harm
email.
lah, right?
Don't be
Yeah,
shy.
Don't be shy.
Yeah. See, that's one of the skills. Don't be shy.
So after IRB, you can get e-data request, and then
Uh-huh.
once that is approved, you roll out your study.
Yes.
So once that is done, will you be writing like a research paper, or like would you put it into a poster presentation, or is that does it usually come in a set, or like is that up to you?
For me, when I do research, I usually want an abstract from it. Like I want to see my introduction, my methodology, my results, and my conclusion. Yeah. So after I get all my consent, my data, and I analyze it, then I will put it in an abstract. Some conferences, they don't require an abstract also. They have their own forms. Yeah. But then for me, to make myself happy,
Satisfied
Personal
lah.
preference, personal
yeah,
preference.
I just want to see the end product of my study. So I would put it in an abstract.
So you mentioned that you like to put whatever research, like results and the whole journey process, into like an abstract. So do you mean like an abstract so that you are able to publish it in the future, like you have something down, or is it just for or like personal gratification?
Yeah, it's actually more of a personal preference. Like I want to see my work, like all my months of work in words, basically. Yeah, but
that's so interesting.
also bear in mind,
Can
some
also
of
use
the
it lah.
yeah, you can present it.
Yeah.
Some of the conferences, you can submit your abstract.
And actually you already have that to go.
Yes,
Yeah.
correct. And then, but some of the conferences, they don't require an abstract. They will have a form for you to fill up, and then you can just plunk it in there.
Oh, that's true.
Yeah. But for me, it's more of I want to see my work in words. Yeah, and it's fulfilling lah, basically.
That's so
And
interesting
also,
leh.
yeah, and then I can show my mentor, like, hey, this is the
This has been done.
results of our work. It's nicely put here. Yeah, and I actually have not gotten to publishing anything yet. Not yet. It's more of when I go conferences, I can present it in a form of a poster. Or my current study, I'm aiming to present it orally. in a conference, hopefully.
CIO.
Jiayo, man.
So you don't want to have a Shafiqah et al.
Yeah.
Shafiqah et
Maybe not
al.
yet. Maybe not yet.
Shafiqah et al. 2025.
For those of you in research, you know what that means. Basically, when we write research papers, right, we have to quote where we get the site, where we get the information from. So Shafiqah meaning she would be the first author, and then et al as in like etc. as in more authors behind. So when people reference it or cite the information that they get, they will put like the first author's name and then ETAL et
Yeah.
al.
I mean, it would
Yeah.
be nice to see, but for now, not yet lah.
We'll be supporting you.
We're still building on her research
Okay,
eventually.
thank you. Next time you reference me, you cite me.
I Shafiqah et al next time lah when I
I
do
won't put
study.
Shafiqah, but
Hey,
I'll put
hey.
Fika et al. Shaf et
Not
al.
allowed.
So through all these hard work, what would you say are the skill sets that you have, taken away from, resilience, determination, collaboration?
I would say heavy on the collaboration part
Mm-hmm.
because I get to work with different disciplinaries also, like the dietitian. It was difficult to get contacts for the dietitian. So actually my mentor helped me to get a contact lah. And then the dietitians were very, very nice. They see our
We see the potential in the study.
they see the potential.
the
They
big
see how
picture.
much we want to help the patients. So they were very kind in looking through all our documents, all our recipes to help the patients. I also work with my other colleagues and I learn a lot from them about data analysis. Yes, and apart from that, also whenever I read a lot of articles, I actually create this Excel sheet. I have a summary, I have the reference, I have the citations. So that kind of like, make me more disciplined.
More organized.
Yes, more
also.
organized, more disciplined in organizing all my articles, all my summaries, so that it's easier for me to look through when I want to create my abstract, my introduction, when I have to reference and cite all of them.
And also, I think like it really helps you to create like a more structured, clear train of thought when you're doing research. Because
Yes.
sometimes information can be everywhere.
Yes,
And it's very,
correct.
very messy.
Very
Yes,
condoing the research.
Yeah. So it really builds your like mental resilience to, push through and organize it.
Yes. So
Yeah.
actually, when you want to create your study protocols and your IRBs, when you are reading all the articles, it's very helpful to create that Excel. As you read, you put in all the important points so that later on when you get your results and then you want to write out your abstract, it's easy for you to reference. Yeah. You don't
So
have to
be-
keep looking at your article anymore.
So be organized from the start.
Yes, be
Pro
organized from
tip.
the start.
Marie
Another pro
Kondo.
tip.
Marie Kondo,
Yes.
your literature.
Okay.
Okay.
So Shaf, have you considered doing a PhD in the future?
Wow, PhD. No, not really. I haven't really thought about masters or PhD because all the research that I do is really with the patients in mind actually. Patients at the heart.
Of what we do.
Yes.
That's right.
Yeah, so actually all of my research is more for the patients and how we can help them on the treatment floor lah. So I haven't really thought about masters or PhD, but
Never
I won't
say
no.
never.
Yeah, never say never.
Right, Dr. Shaf, on the way.
Dr. Shafiqah et al.
You forgot the year. 2025.
2025.
Oh, 2026.
2026.
We are almost to the end, actually. Is there anything that you would like to share for future artists who are keen to get into research but they don't know where to start?
My advice would be to just approach a senior first. Yeah, our seniors are more than happy to guide the younger ones actually. Yeah, so just approach a senior, ask them if they can be your mentor. From there, we'll be able to help you already. Or if you are shy to approach a senior, you can just ask your other colleagues first lah, how to go about it first. And then when you are doing your research, like I mentioned, don't be discouraged if your results are not proving your hypothesis because any result is still valuable results. They are still worth presenting. When you have a question and you want to make it into a research, it helps if you compartmentalize what that topic is. For example, if it's for head and neck or breast or gynae, for NCC, you know who your APRTs are, so you can just approach them. They are more than happy to guide you through how to start a study. And actually, our APRTs are more than happy to have studies pertaining to their
The
site.
field.
Yes, it makes them happy actually. So please approach our APRTs.
Nice. I mean, that's where you want to start lah. For those who don't know where to start, you can search for the APRT.
Or speak to someone that you trust, a colleague at work that you trust, and then let's say if you're a bit shy, maybe that colleague may help you to approach someone else.
Yeah, and actually our APRTs would know best about what are the studies that are ongoing or any knowledge gaps.
Right.
So they can actually tell
Add
you
on for you
yes,
as well.
add on for you, or tell you actually your question or your topic is actually can be a study, or tweak your topic a little bit. Yeah. So
Be ongoing or has been done, or whether it can be done.
they are the best person to go to actually.
Yeah, I agree. So, don't be shy, approach your seniors for any help. But let's say if you really want to, before you approach your senior, you want to try to be more prepared. Try to formulate your own hypothesis or question. Maybe one thing that I remember that was taught in university when we were doing our thesis, by the way, me and Shafa are batchmates.
Yeah, we are
So
classmates.
we are classmates. So one thing that was taught was using the PICO method, which is PICO. Basically, PICO, it's a structured framework used in evidence-based practice and research to help you to formulate a clear and searchable hypothesis. So PICO basically stands for P, patient, population or problem, I, intervention, prognostic factor or exposure, C, the comparison or control, and O, which is the outcome. So using PICO, it will help you to define your question very clearly so that you're able to then approach it with a clarity.
Yeah.
Right. Yeah. And anyway, we will have a link in our Spotify or YouTube or wherever you find us to read up more on that. I think that may help some of you guys. I think that has been quite an in-depth session.
So to summarize whatever Shaf has said is like, first of all, I think it takes dedication and interest and passion
To
as well
start
to start
research.
research. But like Shaf said, for any unanswered questions, you can actually go in depth and then do some research about it. Read through a lot of articles. You really need to do a lot of research, right? Do your own homeworks and everything. Before you even find your seniors, you have already something in mind lah. Then once you have already something in mind, then you approach any seniors that you feel comfortable with. APRTs especially. Then from then on, you build up with your IRB, right? The day you have already all your materials ready, you fill up the IRB forms. And then once IRB approved, then you can start your studies or research.
Or any other applications that your institution needs before you roll out like the study. So I think one very important takeaway is that no question is a dumb question. Don't be shy. If you don't have an APRT in your center, maybe approach a senior that you trust.
Yeah.
And then see where it goes. You don't have to have a burning passion for research, but as long as you're interested in something, just wet your feet, dabble in it and see where it takes you.
So thank you, Shaf, for chatting with us about research and how artists can become a researcher as well.
And also, I think because Shaf is still like new-ish into research, it allows, I think, listeners who are new and also want to start, gives them like
Or relatable lah.
a relatable information.
Okay, so if you have any burning questions, check out the feedback section on our website and feel free to leave feedback, more episode suggestions, or encouragement for the speakers or hosts. We love to hear from you.
So please rate, review, and subscribe. Follow the podcast on Spotify, YouTube, or wherever you get your other podcasts. Thank you for listening again, and this has been your dose of content for all things related to integral to radiation therapy. See you in the next episode.
Bye!